Hi folks, I'm Matt Scalise, Doctor of Physical Therapy, McKenzie Spine Rehab Specialist, and Orthopedic Certified Specialist. Today I want to talk to you about the lumbar disc and its possible role in your low back related problems. In your spine there are 5 lumbar discs, and both above and below each disc is a bone, otherwise known as the vertebra. The lumbar spine has 5 discs, and both above and below the disc is a bone called the vertebra. Inside each disc is a jelly-like substance. I often describe it to my patients as toothpaste type material. Inside each disc is that jelly-like substance called a nucleus, and it's surrounded by a rubbery outer coating called the annulus. Just to demonstrate that again, here's a unfrozen cold pack to further demonstrate. Inside the disc, jelly-like substance called nucleus, surrounded by a rubbery outer coating called the annulus. We've talked about the basic anatomy of the lumbar disc. Now let's more specifically talk about how the lumbar disc may be influencing what you're feeling as a patient. Let's refer back to that jelly-like substance called the nucleus. So that gel-like substance within the disc is impacted by the pressure of the bone or the vertebra sitting on top of it. So when that vertebra is tilted in one direction, that jelly-like substance will tend to move and get milked in the opposite direction of where the pressure is, and vice versa. And really throughout the day, there's a kind of a battle being waged to try to establish equilibrium within the disc. And problems arise when too much pressure is directed in one position versus the other. But in an ideal situation, as alluded to already, we want that gel-like substance to be equally distributed. Let's think about what we do as a society. You and I and the rest of society, we're very guilty of sitting for prolonged periods of time. We're also guilty of doing many activities bending forward, whether it's for work or for gardening or getting different things throughout the house. All day long, I think we're all guilty of spending many hours in a sitting position, invariably in a slouched sitting position. And we do tons and tons of activities throughout the day that require us to bend forward. Well, the distribution of the gel is influenced by the vertebra above the disc. So when we sit in a slouched position, or if we repetitively bend forward as if in tying our shoes, pressure is created in the front portion of the disc, and that provides an opportunity for the gel-like substance to start to migrate towards the back. If this migration of the fluid is significant enough, it could put pressure on the back portion of the disc, stretching the back portion of the disc, and this is called a disc bulge. A disc bulge is capable of not only causing back pain, but also pain into the leg as far down as the foot. If this bulge is significant enough, it could press on an adjacent nerve. This is a situation we call sciatica. In sciatica, not only can we feel pain into the legs, but also numbness, pins and needles, tingling, and also weakness of some of the leg muscles. There are times when the gel can squirt out of the back portion of the disc. The toothpaste can come out of the toothpaste container, so to speak, and a rip has been formed, a tear has been formed in the back portion of the disc. This is what we call a disc herniation. The symptoms of a disc herniation mimic the symptoms of sciatica. The only difference with being the cause of sciatic pain due to pressure of a disc onto a nerve, whereas the symptoms from disc herniation is due to a leakage of the fluid onto the nerve. The gel-like substance, this nucleus that we talked about in the past, is highly inflammatory. So when it bathes and coats the nerve, it's like throwing a match onto gasoline. Now the good news in all of this, and yes, there is good news, is that just like we have the ability to put that jelly-like substance in a precarious position, we also have the ability to put that jelly-like substance into a more desirable position. Sometimes we're able to do that spontaneously. Sometimes we need the help of medical professionals like physicians, physical therapists, and chiropractors. And if you're asking yourself the question, the answer is yes, discs can unbulge. So there are positions, there are movements that could help put that disc back into a more desirable position and stay there. When our own movements or the instructions of therapists and chiropractors and physicians don't help, sometimes medicine is needed to be prescribed to calm down the inflammation. Sometimes the medicine needs to be backed up by an injection. And sometimes in rare situations, surgical procedures need to take place to correct the anatomical problem. Well, I hope all this information was helpful for you. Once again, it's Matthew Scalise, Doctor of Physical Therapy, and I look forward to providing more information on your low back related problems in the future.